A very good afternoon to all my subscribers, and today is actually going to be a discussion we are going to have. This is a highly requested video I was told to do. I have received a lot of messages, and this is on high blood pressure or hypertension that we commonly know as. I think we have a lot of evidence-based medicine which tells about how medications can decrease your blood pressure, and when you go to see your physician or to concern about your blood pressure, you're given or handed over a blood pressure medication. However, 70% of hypertension can be reduced by diet and lifestyle changes, and 30% is medication. I'm not saying this. American Heart Association, American College of Cardiology, American College of Physicians, this is the data from them. This is evidence-based. And today I just want to take a moment and I want to just talk about the things that we can do to decrease your blood pressure without taking a medication, and how you can do it without having a medication. So I want this video to be a sweet and a short one so that I can hit the bullet points, and I will try. If you guys like the video, please subscribe to my channel. I usually talk about beauty, lifestyle. I have done a few videos on CBD oil, and then on our yoga balm. This is probably my first video that I'm doing on hypertension or similar topics, and definitely I'm NCQS certified for heart, stroke and diabetes, and this is very close to my heart. Every day I see this, and I feel that we do not bring out the best things for treatment of hypertension, which are actually not medication but something else. So without further ado, let's get to it. And I need my reading glasses. Without that, I am absolutely blind. The first and foremost one that I want to talk about is waistline. So we have come to a conclusion, American College of Cardiology, American Heart Association, everywhere we have come to a conclusion after looking at the evidence-based medicine that for males, 40 centimeter or less waist circumference. So what you could do is, the day like you want to find out what your waist circumference is, and you can take a tape and go and measure the waistline. A lot of big employers are putting the waist circumference on their biometric screening form. These are like screening forms that I usually sign off on patients. These are from bigger employees, and they are actually giving a gift of monetary gift to the employees if their waist circumference is less than 40 centimeter for men and less than 35 centimeter for women. Why is that number? Because we have seen that if you are less than 40 centimeter, and if you're less than 35 in women, then your risk of heart attack and stroke drastically gets reduced, and your blood pressure goes down significantly if you are reaching that waist circumference. So there is definite data. It's backed by lots of evidence, no questions asked. This was my first rule for reducing blood pressure without taking medication. Rule number 2. Our second rule is less salt on your diet, and I cannot talk any more than this topic. The first thing that I do when I see a person who has blood pressure, now remember, how do you define, or what is that blood pressure number? So without having any pre-notion, I just want to tell you guys that if your blood pressure is between 120 and 139, it's classified as pre-hypertension, and they are being treated for high blood pressure. However, I think before we go on to giving the first medication, it's so very important to sit down with the patient and find out how much salt they are eating every day, because a single marker salt can reduce your blood pressure by a huge amount of points. We are talking about 7 to 10 millimeters of mercury. This is backed by evidence. So American Heart Association has given the guidelines of having a person take I think it's 1500 milligrams of salt a day. I personally feel 1500 milligrams of salt is very, very less for a person. So what you can go with is approximately 2300 to 2400. Now, of course, if you have other problems going on, we are not talking about other things, congestive heart failure, chronic kidney disease. This is something that you're going to talk to your physicians about. I'm just telling you, almost like a person who has high blood pressure and they are trying to bring down their blood pressure naturally. A sodium level, a sodium amount of 2300 is probably going to be okay, and that's for the entire day. Coming to that, I think that the amount of blood pressure difference from 1700, which is the current guidelines on American Heart Association, to 2300, the blood pressure difference is 3 millimeters of mercury. I don't think that's very high. However, if you can keep your sodium level restricted, it's going to be a huge blow for your blood pressure, because that's going to really bring it down further. Coming to my next topic of discussion is, so we just talked about how we are going to reduce the blood pressure by reducing sodium. Something which is very much tied. By reducing sodium, you want to increase potassium, which is another body salt. So the next rule that we have is taking more potassium in your diet. So the minute you're going to take a high potassium diet, now make sure you are not suffering from congestive heart failure, chronic kidney disease and other things, because in that the guidelines are absolutely completely different. But this is for people who have only high blood pressure, or they have high cholesterol and they're trying to decrease their blood pressure naturally. Adding potassium food to your diet. Now, I am a huge believer of food as health, because to me, there is nothing that God has not given us to bring down our blood pressure. We have so much foods around us that can decrease your blood pressure. It's unbelievable. Strawberries, blueberries, raspberries, spinach, bananas. I eat at least one banana a day, or maybe 2 bananas a day. I know a lot of people are going to like, bananas have too much calories. Yes, but banana is great. It's going to prevent your muscle cramps when you're exercising. It has so much potassium in it. Literally, bananas are like a reservoir of high potassium in your diet, and I love bananas. And there are lots of other foods around us, and I can actually do a whole video. If you guys like it, please put a comment below as to if you want to know in details of any of these topics, to go a little bit deeper into what potassium does, what sodium does, and I can do or break down the videos into smaller portions, because I don't want to make this video a long one. Coming to the next point, we tell the patients to follow a DASH diet, DASH DASH diet. So DASH diet is basically nothing but diet in modification with healthy fruits and vegetables and lifestyle changes. So basically, my next topic of discussion is adding lots of fruits and vegetables to your diet, and that can really make a difference to your blood pressure. The next one, which I'm going to talk about, is actually very close to my heart: relaxation. And the reason I say so is because our life right now is very, very fast. We are leading a life which I don't think our previous generations have lived. And this is a very, very fast life. You need to come home, and I tell this all the time to people. I'm like, you need to come home and you literally need to unwind yourself from the entire day. This was a very, very long day for you. You need to switch off your cell phones. If you're done with your Facebook, socialization, if you're done with your YouTube socialization, if you're done with the Instagram socialization, please, please, please put the phone away. Put the phone on an off mode. And before you go to bed, you need to unwind yourself. That bed is not meant for an iPad. That bed is not meant for a phone. That bed is meant for you to sleep. So that bed should be treated with utmost respect. That is where you spend 7 to 8 hours of your day. That bed is meant for you to unwind, meditate, or do some things that can help you just kind of unwind. And that time is your time. Whatever you want to do, if reading a book is the way that you unwind, absolutely. You need to unwind yourself by reading a book. If a person thinks that listening to music can unwind you, and this has an utmost effect on high blood pressure, because no matter what you are doing, social media, Facebook or Instagram or YouTube is going to make your blood pressure go higher. And I cannot say this anymore. I'm not saying that you're not going to watch your favorite YouTube video. Please, please, whatever makes you happy, do it. But those last 30 minutes of the day, please, 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 that's for yourself. Your body is like a temple. You need to worship. You need to give 30 minutes to that body. I'm going to have a whole 30-minute video or something like that. Maybe a 10-minute video on how to unwind yourself so that you can get ready for bed and have a good night's sleep without taking a medication to go to bed. Going to our next topic of discussion, we have gratitude. So I felt that this was very important. I felt that this definitely needed to be in my video. What's gratitude? So basically, gratitude is you are grateful to whatever you have. So in the morning when you are waking up, before I get down from my bed, I do a few yoga poses, and those I really do to kind of just feel grateful and happy that I'm breathing. God has given me a beautiful life. I'm blessed with whatever I have, and I'm even blessed with whatever I don't have. I stay grounded in that way. I feel I'm just living my best life every day instead of having to wait for a vacation to live my best life. I want that positivity to be part of you. Be grateful to everything that you get in life. If my daughter makes breakfast for me on a Sunday morning, I'm so grateful. I am happy. I'm a happy mom at that point. My husband brings home a small rose or something and says that I know you had a long day. I hope you feel better. I just feel grateful. Small things in life makes me happy. I just want happiness is a state of the mind. If you are happy, you are going to decrease your blood pressure, because happiness, what does it do? It releases endorphins. It releases substances which decrease your blood pressure. So that's one of the very big things to decrease blood pressure. I think we are almost at the end of it. And the last but not the least, which I live for, and it's exercise. Exercise can decrease your blood pressure. I do aerobic and resistance training both. I have a Peloton at home. I do cycle every day in the morning or in the evening. I also do yoga. I try to do about an hour of exercise. You do not have to do an hour of yoga or an hour of exercise. It is recommended to start on a slow state, like so maybe 10 minutes a day. Start with 5 to 10 minutes of walking or jogging or whatever you want to do. Just make sure that you have your blood pressure under control, because you do not want to exercise if you have high blood pressure. But exercise can decrease your blood pressure significantly. 150 minutes, 150 minutes of exercise has been studied and seen in evidence-based medicine to decrease blood pressure quite a bit. So that is something that is a lot of things to cover on the whole theory of exercise or resistance training that can decrease your blood pressure. I think that's a video which is solely meant for that. So I wouldn't go any further. I'm going to stop this video right here. Please write down any questions you may have. And this is something very, very close to my heart. So hopefully I'll be able to answer the questions. Hope you enjoyed the video. If you want to hear from me any topics of discussion, diabetes, high blood pressure, high cholesterol, or anything like that, please list down below. Please subscribe to my channel and comment and like on my video so I can keep on doing videos like this. I hope you guys have a very good rest of the day. Take care, guys. Bye.